If you imagine the uterus as a big muscle, and that's how you contract during labor, Braxton Hicks is kind of isolated areas of the uterus practicing. Those muscle fibers are starting to contract because the brain is starting to make some of the hormones that you'll eventually need to initiate labor. Braxton Hicks can start as early as 20 weeks of pregnancy. That's fairly uncommon. You're much more likely to have those in the third trimester, usually starting at about 28 weeks onward. It varies for patients, and you may find that patients that it's not their first pregnancy, that they may start a little bit earlier on average than ones that it's their first pregnancy. It's not a sign of imminent labor. I tell people you can have Braxton Hicks that are a day before you go into labor. You can have Braxton Hicks 3 months before you go into labor. Characteristics you'll look for to think that they're Braxton Hicks, sometimes called false labor: irregular, tend to be mild, uncomfortable but not painful. They will sometimes go away by changing position or resting, taking a warm bath. Make sure you're hydrating, things that active labor doesn't usually go away with. I would say if you notice any vaginal bleeding, even if the contractions are fairly mild or you're having leaking of fluid, those are things you want to call your doctor about, even if the contractions themselves are not super severe.